Hello, everyone. Welcome to Bloomington Ekal Youth Board's first podcast. Today, we have with us Dr. Sanjay Saxena, the president of UVA and a pediatrician we all know very well. We will begin with introductions of the board, and then Dr. Saxena will answer your questions about academics, finding a career, balancing your life, and more. We are very excited for this youth-led initiative, and we welcome your feedback as we grow this podcast series. Make sure to follow us on Instagram at Ekal Youth Volunteers for the latest updates and new podcast episodes. Without further ado, here is our first episode. Enjoy.
My name is Pranati.
I'm Sonika.
I'm Hamsini.
I'm Mojis.
My name is Adi.
I'm Ashwini.
We're missing Avani right now, but we are the board of Ekal Helping Hands. And the latest project that we wanted to get started on was a series of podcasts. So we wanted to create podcasts inviting people from not just in Bloomington, but all over the US using the Ekal connections, and really create a resource for our members that tells them useful tips about leadership, career opportunities, just life in general and what to expect when going forward. And our first guest for today is Dr. Sanjay Saxena. Hi, how are you doing? How is that?
I'm doing fine, thank you. Thanks for inviting.
So how do you balance the, the entrepreneurial side of owning a practice and being in charge of 15 employees, as well as being a doctor and taking care of your patients? How do you manage that?
So I think it's one of the things that you have to delegate, and I think I learned a little this with slight difficulty, because sometimes it happens is that in the office, maybe education-wise, I have the most education out of all. And certain things, if I just take it in my hand, sometimes I think that I can do faster and I can do quicker than the other people, but it doesn't work that way. So I think I, learned it hard way. I said, I need to delegate and I need to accept the way their quality of the work is. I mean, that's, they cannot be the physician also. They're going to be office managers or this and this, and you have to accept and you have to train them and get them up to that level. So just delegation is one thing where we just want to make sure that we're delegating, giving people a right to do certain things, and they can just work within that. So that works the best as such. Again, I like doing it. That's why I never regret it. I know some people would not like it, and they just want to be employed by somebody and just not have to worry about all this as such.
Passion of yours to be heavily involved in your cultural community, or what was the path to?
So I think because I said I grew up in India, so in India when I was growing up, I've never thought I'm going to be doing this, and just because there the exposure is so much, it's so much around, the same culture is so much around. When you come here, I know that the initial year when I came, it's just that though I think we still had the family, we can get Indian food or so, but just the environment that we had in India, you still miss it. You still missed it. So just for the community, I know at a certain time when we had so many people in town, people were meeting at everybody's home on a weekend. So then we thought that having our own space for the community would be a good thing, and that's where the whole idea started. And then once we were committed in it that okay, we need to make it happen, then we just wanted to make sure we make it happen. And one part of it is that I think where I was more involved with the education part of it, and that actually taught me so many new things about our own traditions and culture and the dharma. And then I'm just more into that part of it as such, and that just excites me, and that's what keeps going, where we just keep doing for the organization also.
Where do you see the medical industry going in the future? I mean, there's already been so many changes, and as you mentioned, like the medical industry is an ever-changing field. New discoveries are made every day, and especially with the rise of technology. But where do you think that it's headed in the future?
So I think the heading is the direction is the same, where it's all where the money goes. So there's one thing about the system of allopathic medicine. It's very profit-oriented medical system. Um, so wherever the funds get pushed into, you're going to have that technology coming up, and it'll all be money intensive no matter what. So there's nothing which is coming which is going to be cheaper on the patient pocket or so at the end of the day. So technology would keep going up high and high. So one thing, I have a perspective on it. I think the allopathic medicine, if we compare to some other, and I don't know if you know a little bit about the Ayurveda, and I guess you probably would know because what your mom is telling, a lot of times the home remedies are coming from their knowledge of Ayurveda. And that focuses more on your preventative lifestyle. So one of the things that we lack in allopathy is that, and we started doing, and I think the good thing is, though, allopathy does have a room for change. So if somebody really pushes it and say it's a value to the system, then that'll get accepted. Though I think money is still kind of on the top list. Are we producing profit or not at the end of the day? So in that case, I think telling people to change their lifestyle is a very difficult thing to do. So, but that's where the Ayurveda is all about lifestyle. You prevent things before they happen. So, and that approach is obviously way economical, way better for people as such. So preventative part as such is a component, but it still is a lesser practice component in allopathy than some other medicine as such. So this is where I think it needs to go to, but I think the way the technology is going to keep going up and up. The more the technology goes up, it only caters very few percentage of the population.
Is there any specific quote or philosophy that motivates you?
No, so I think so. One of the thing is, and this is just when you start getting to a stage where you think that what is the purpose of life, and I think this all happened when I was part of the temple or so. What are we doing? Are we doing good, or it could be better or not? The bottom line, it comes down to that at the end. I usually tell that we're all born, so one day we'll have to leave this body. That's truth with everybody. Though I think people, when they're very young, we don't think about it, which is all fine. But once you get to a certain age or so, we start thinking about it. So then what is going to be the takeaway? Because we're going to all go. That's the truth. That's a fact. And finally, it does comes down to that how many, this is just what I think, how many livings or non-living things that we positively contributed throughout our life. So just the extent, it's just the accumulated number, and that's all you take away. So this profession is such that it gives you a big opportunity, though it's not the only profession which can do that. But this gives you a very easy opportunity, or your sometime day-to-day things is what you're doing is in a way helping, though it's just your job that you're doing. So the medical profession has that advantage, and there's some other professions that work the same way, I think. Because a lot of times when some of the students who come and they want to rotate in our office, the first question I also ask, why we want to be a physician, and their answer is, oh, we want to help people. Well, you don't have to be a physician to help people, first of all, and you don't have to be even getting some degrees or diplomas or so to be helping people. Nothing, zero. So it's only passion to help people is all you need at that point of time. So obviously that's not a right answer for anybody who wants to be a physician, that I want to help people. But it's a side thing that you get. The benefit of being in medicine is that it gives you that is very easy. You don't have to go out anywhere. It's happening right every day what you're doing.
So you made it through medical school, and obviously you have your own practice now. And how does a typical workday look for you?
So it's one of the things is that I think mine might be different than one thing in the medical profession is that once you graduate out of medical school, your options are way too many. So that's one good thing about it. So if somebody does not like, they're more introvert personality, they do not want to interact with people. There's definite fields where you would not never interact with a patient. So, you go into pathology, radiology, all you're looking at is something on your screen, x-rays or so, or the pathology is just getting some reports, or the labs, they're running the labs or so on the samples. They don't see the patients there. So there's different options, and there's obviously some which is like what I'm doing is called ambulatory care, where you just kind of see patients. So you're interacting with them every day, and somebody has to enjoy it, like seeing 40, 50 families and talking to them or so. So it's all, you can decide where you really want to go at that point in time. So and there's a lot of options. So in terms of subspecialty, the specialties within medicine, so that's one good thing. It gives you a big range out there, which you can go through. My journey, I think something I'll let you know, I think I said medical school somehow, I like few things, I did not like few things. And when I got out of that, there's an internship that you go through, and the internship part was really interesting. So I like pediatrics and internship, where you rotate through different specialties. So you're going through medicine, you're going through obstetrics and gynecology, you do medicine, surgery, and all those things. And the pediatrics, to me, seem to be the most interesting ones. And the results were very dramatic. We had little babies there, and the excitement of just getting them, better or so. And a lot of times, they get sick very quickly, but they get recover very quickly. So the results were very dramatic and very rewarding in that way. So that way I really liked it, and I pursued pediatrics there. But when I entered here, the system in India, and this is in Delhi, I think our resources were so less, and we are following the medicine. So one thing is that, again, medicine that's not allopathic medicine. So I know we are talking about allopathic medicine right now. And allopathic medicine is probably the most funded one throughout the world. So it became the most popular way of treating people. There were other alternative means which were there in the past, but right now, the way things are, I think allopathy is overshadowing everything, every other alternative medicine. Though in the United States, there's really an awareness of what is called as an alternative, they call it alternative medicine. So there are other ways of treating things also, not just the allopathic way of doing things. And allopathy is expensive. So I think it invests a lot of money as such. And when I was doing my internship there, and in fact, the post-graduation, the money was really short. There were a lot of poor people. And the care just get affected because even the hospital does not have enough resources to take care of it. And when that started happening, and I was always fighting with the administration about it. And at one time, I wanted to quit it. I didn't want to do it anymore. It's just that at that time, the option came that, I could have come here. And one thing is that though it's very expensive, it's here also hits the pocket of the patients, but at least the system was set up in a way where you could actually do things much better than how you could do. So then your interest comes back again that no, it's all worth it. And then we just continue there. So it's always, I think once we choose any profession, it's not that it's going to be totally smooth and your interest is going to be same throughout. So, before I got into the day you get into medical school, so excited, like everything is set, life is set, but it's not like that. So once you go through it and it's just, you like something and you don't like something and you're just sitting in the night studying or whatever and getting through things or so. And then even after graduating and you're trying to decide which line you're going to choose. I still have setback where I think I'm doing a post-graduation in pediatrics and I don't want to do it anymore. I want to quit. So it can happen. It goes up and down. And finally, you do the residency and where you're going to be in the job, whether you're going to like the setup where the job is, or whether you want to work under somebody or you want to be independent. And for me, what work is this being independent and owning a practice. One thing it does is that I just not only do the medicine, I'm managing 15 employees. Sometimes my day starts with a problem with the employees, not the patient. So then I'm solving those problems first by the side, and then just other things are there, and which keeps things interesting for me. It doesn't makes things very monotonous, and that's just a personality. I might not have just done one thing, so I like doing different things as such.